based on the way that the vaccine is made and based on what we know about vaccines in pregnancy, we do feel like the vaccine is safe in pregnant women. The vaccine is not a live virus, and the only vaccines that are contraindicated in pregnancy are those that have a live virus. There does not seem to be any need to wait any amount of time before trying to conceive, even if you conceived in the middle of your vaccine. So there's been incidences of, in the studies, people who'd gotten the first vaccine and then actually got pregnant before they got the second vaccine. No, there seem to be no issues with that, and no recommendation on a certain trimester that you should wait until to get the vaccine. You should get the vaccine when it is available to you, is what our recommendation is. So no, the baby is not vaccinated, and because of the way the vaccine works, it actually gets out of your system pretty quickly. So we don't really know for sure if there's going to be much protection to the baby from the vaccine. The hope is that maybe the baby will have some form of antibodies, but it definitely can't hurt and may provide some protection for the newborn. Pregnant moms do have a 70% more likelihood compared to their non-pregnant counterparts of having more severe disease with COVID. In addition, they have around that same percentage higher risk of having to be intubated as a result of having COVID. So we haven't seen a lot of effects as far as actual effects on the baby, except for the moms that do get very sick and may possibly have to be delivered early. And like I said, for the most part, our pregnant moms are having fairly mild courses, but the ones that get sick are getting very sick. And there have been several pregnant women across the country that have died with COVID that were otherwise fairly young and healthy women. One of the things to think about is what is your lifestyle and what kind of risk factors do you have in general for getting COVID. So, I mean, a patient who truly stays at home all the time, their family is all able to isolate and stay at home, or someone who's had a history of an allergic reaction to a component of the vaccine, maybe they could consider waiting. But the likelihood that someone is really in a situation where they can stay at home their entire pregnancy seems very, very slim. So I think most patients really in the world we live in, especially in our area where we have rising COVID cases, as soon as the vaccine is available to you, I feel like it's your best option to go ahead and get it. If you still have questions, I would definitely recommend discussing it with your individual obstetrics provider. Great resources that you can look at online would be the American College of Obstetrics or Society of Maternal Fetal Medicine documents. Those are going to be very reliable. That's where most of us as OBGYNs get a lot of our resources from. So they're going to have good documentation that hopefully would give you a little bit more peace of mind about the safety of you getting the vaccine.